Hi, I'm Katie Owens. I'm both excited and humbled to share with you my presentation from Stanford's MedicineX. Today we're going to talk about confidence in general and in healthcare and how I'm finding it matters. Will you do an experiment with me? If you're comfortable, close your eyes. Think about a time when you felt truly confident. Really be it. See it. What do you look like? How do you sound? What's the impact or effect you have on others? Now open your eyes. I'm willing to bet that many of you are just standing up or sitting up a little bit straighter. That feeling, regardless of if we have words for it, is confidence and what it does for us. Now, as much as I hate to ask you to do this, I want you to think about a time when you felt timid or uncertain. What did that look and feel like? What was the impact that it had on you and others? Did you feel uncertain, not as capable? What was the difference in your tone, in your magnetism, in your swagger between those two instances? Did it affect your performance? Research shows that when an individual is expected to fail, their performance nosedives. Yet if you take that same person with expectations for success, their performance shines. Same person, different expectations. Confidence is the state of feeling certain about the truth of something, or a feeling of self-assurance arising from one's appreciation of one's own abilities or qualities. We know that confidence affects performance at work, at the individual, leadership, and organizational levels. It influences success at sports and on teams, even in relationships. But we've got a lot to learn about the role that confidence plays in healthcare. I want to share with you findings from a study I had the chance to author with Stephanie Keller and HealthStream. We looked at the impact of caregiver or employee confidence on patient perceptions of care. We did that by surveying employees at 40 hospitals, and we asked them to rate the quality of the patient experience they're providing. We then matched patient experience survey results to those same 40 hospitals to look at similarities and differences. We found that caregivers always rate themselves lower than patients by as much as 40 percentage points. And here are some of the game changers. We found that as caregiver confidence grows in the patient experience they're providing, patients then report a more favorable experience of care. And caregivers are more likely to intend to stay at their organizations. What a huge opportunity to make a difference. So what builds caregiver confidence? We know that confidence is evaluated in the most primitive part of the brain. We want to know if we can trust and respect someone. Next, we need to make certain that we are managing patient perceptions of care over the entire duration of their experience to instill trust, respect, safety, and provide assurance. We need to remember that confidence does not equate to competence, and we have to cultivate a climate of learning where we're able to build mastery of key competencies that deliver the best care and allow patients to perceive the best care. We have to build resilience. When people believe they can cope with a challenging task, they're going to be less anxious in the moment. And lastly, we've got to celebrate our successes. Have gratitude for when things go well, and begin to have high expectations or higher expectations for ourselves and the patient experience we're providing. Confidence, or the lack thereof, is either going to be a bridge or a block in empowering caregivers to deliver the best possible experiences and care, and patients having the expectation that they should be receiving the best health care. I'd like to share with you a perspective from a physician, otherwise known as my husband, Matt. He talks a lot about confidence because it's important. He has shared that his team and him need to project confidence, and patients and families need to have confidence in him. It's bi-directional and it can't be one way. If it's done correctly, it's going to lead to a patient being more confident in me or him and the relationship that we have to care for their health and life. As caregivers, it's all too natural for us to have low self-esteem about the patient experience we're providing. We know our bruises, our blemishes, our weaknesses all too well. But yet achieving success in the healthcare experience is dependent upon us being confident in our abilities, building resilience when times are tough, and giving patients every assurance that they can receive and expect the best care possible. Thank you. It's a privilege, an honor, and a responsibility to talk about confidence. It's a topic that we care deeply about at the Healthcare Experience Foundation. In the words of Theodore Roosevelt, do what you can with what you have where you are. And we have a firm conviction that building workforce confidence will allow us to be well positioned to deliver patients the best care that they deserve to receive. I hope you have a great day, everyone. Thanks for listening and watching.